Alcoholism. Alcohol is one of the most common addictive substances. It is a chronic disease of alcoholism which is characterized by uncontrolled drinking and individual is preoccupied with alcohol. According to World Health Organization, globally 3.3 million deaths occur every year due to harmful use of alcohol. It is very dangerous for our physical and mental health. Prevalence. The prevalence of alcoholism is increased from 5% to 20%. Causes. The exact cause is unknown, but there is a combination of genetic, social, and psychological problems and environmental factors that plays very important role. The problem is higher in low income groups and working classes. Chemically, alcohol tend to reduce the chemical activity of substance that affect the nervous system to inhibit the behavior, mainly GABA, gamma aminobutyric acid, and increases the activities of pleasure-seeking processes, which result in people being less inhibited in their words and actions and more engaged in immediately doing pleasurable activities. Stages of alcoholism. It can be classified into five stages. First, pre alcoholic. A person begins to drink to relieve stress. During this stage, tolerance can start increasing and meaning more alcohol is needed to get the same effect. Second, early alcoholic. During this phase, alcohol can begin to affect the person's relationship, job, and daily life. Third, middle alcoholic. During this phase, drinking becomes more frequent and individuals might try to hide or rationalize their drinking. They might also try to quit only to start again. Next is late alcoholic. At this point, the individual can no longer control their drinking. They might also exhibit physical symptoms of prolonged alcohol abuse. And the fifth stage is the recovery. The recovery phase is when the individual gets help. There are many risk factors for alcoholism. More than 15 drinks per week for a man, more than 12 drinks per week for a woman, drinking more than 5 drinks a day at least once a week, a parent with alcohol use disorder, mental health problems like schizophrenia, anxiety, and depression, in young men under pressure from the peers, persons with a low self esteem, persons suffering from high risk of stress. The main signs and symptoms. The signs and symptoms depend upon the intensity of alcohol addiction. Signs and symptoms include people with chronic alcoholism may be able to have some severe drinking before appearing intoxication. Short term physical signs and symptoms such as poor concentration, inability to walk, slurred speech, slow reaction, hangover, or blurred vision. Certain long term signs and symptoms include malnutrition, liver cirrhosis, liver damage, anemia, hypertension. They are also having an increased risk of heart attack, gout, stroke, dementia, and sexual dysfunction. The behavior abnormality are also increased in persons drinking alcohol. The method of prevention. Psychological counseling can help in solving some problems. Then individual can recover with family support. Withdrawal symptoms can be medicinally managed by sedatives, oral medications to reduce the craving for alcohol, and engaging in physical activity and reducing stress. Management. The main ways include family counseling by a clinical psychologist. There are many medicines for alcoholism in homeopathy. So the homeopathic physician took each and every signs and symptoms of the patient, and after the individualization the proper medicines was given. The commonly used medicine include avena, Naxomica, apocynon, capsicum, crocus, sulfuric acid, etc. Thank you.